Minister, you're very welcome to the House this morning, and today I would like to discuss the crisis that's in home care and home help in our HSE sector. Elderly people are suffering, Minister, without home care because home care packages have been frozen by the HSE. No new hours have been allocated in the CHO1 area since February of this year. It's on complete shutdown. The CHO area includes many rural counties, among them counties Monaghan and Cavan. In Monaghan and Cavan, almost 300 people are waiting on home care packages. Some have been approved for some time for a home care package, but are still waiting on one to be provided. Almost 50 people are on what is called a priority list, and that's people with a very high dependency and have been waiting over a year for a service. These people, in most cases, are elderly and are very vulnerable, are in need of our care and support. Minister, as I said earlier, this is a national disgrace. There is a crisis in this sector. We're letting down the very people that have given so much to our country and now are in need of our care and support in their later years. The system, in my opinion, is broken. It's not fit for purpose. It needs a complete root and branch review. Most people, as I'm sure you'd agree, Minister, would like, where possible, to remain in their own home, among their family and among their own community. But the system at the moment is not allowing them to do so. Many families go to great lengths to ensure that their loved ones remain in their own home. Many of them with young families themselves and are working and are doing all they can to ensure that their loved one remains at home. But we, as a state, are letting those people down. In my opinion, every single cent we spend in home care and home help is money well spent. Many millions of euros are spent throughout the health service in all in good need, but I would suggest that every penny we spend in home care and home support for our elderly is one of the best investments we can do as a state. In actual fact, it makes no financial sense whatsoever that we don't do this, the net result being that our elderly people will end up in a nursing home, or worse still, due to lack of care, will end up in an acute hospital setting, lying on a trolley waiting to be seen. Clearly, I don't use the word crisis in an exaggerated fashion. There is a serious problem here that needs attention. The 300 people in Cavan and Monaghan that are waiting on home care need money in order for that to be provided, and I'm calling on you, Minister, and the Government to allocate funding to assist and help those people remain in their own homes where they would like to stay.
Thank you, Minister, to respond.
Thank you. I want to thank Senator Gallagher for this morning for his Commencement Matter, and to thank the Senator I will be taking on behalf of Minister Daly. The Government's core objective is to promote care in the community so that people can continue to live with in confidence, security and dignity in their own homes and in their community for as long as possible. A wide range of services are provided, including home support, day care and residential care, through direct service provisions and through voluntary and private providers. Improving access to home care support is a priority for the Government. Over the past 4 years, we have seen a considerable increase of nearly 140 million in the budget, which has grown from 306 million in 2015 to almost 446 million in 2019. Over 53,000 people will receive more than 18 million home care support hours this year, including intensive home care packages to about 235 people. Despite the significant level of service provision, the demands for home care support continue to grow. The allocation of funding for home support across the system is significant in finite, and services must be delivered within the funding availability. Preliminary data indicates that during the first quarter of this year, 4.2 million hours were delivered nationally. 4,411 new clients commenced the services, and 6,238 people have been assessed and are waiting for either new or additional home care support services. Minister Daly acknowledges that in some cases, access to the services may take longer than we would like. However, the HSE has assured the Department that those people who are on a waiting list are reviewed and funded when funding becomes available. This is to ensure that individual cases continue to be dealt with on a priority basis within the availability of resources and determined by the local frontline staff. The local staff know and understand the client's needs and understand regular reviews of those care needs to ensure that the services being provided remain appropriate. The number of people waiting for funding for home care support service reflects a point in time. While there exists home care services is delivered crucial support to many people across the country, it is acknowledged that the services and the access to the services need to be improved to better meet the changing needs of our citizens. This is why we intend to establish a statutory scheme for home support services, which will improve access to the services on an affordable and sustainable basis, while also introducing a scheme of regulations that will ensure public confidence. And I will come back on some of the issues.
Brief supplementary.
Minister, thank you for your response, and I appreciate this is not your area, but I do accept your response. But I must say that I'm disappointed with the content of the response. Clearly, there's little comfort here for the people, the over 300 of them that are waiting on home care packages in Monaghan and Cavan, and very little comfort for their families as well. And people are saying to me that we can spend billions building hospitals, we can spend billions on broadband, but yet and all, when it comes to basic care, that is looking after our elderly, we're selling them short. And I would appeal again, Minister, that additional funding, we're talking small amounts here, it could take as little as €100 a week to make sure that someone has a basic home care package to remain in their home. And when you compare that to €1,000 to €1,200 to stay in a nursing home, or even worse still, end up in an acute hospital setting, it doesn't make economic sense, the road we're going down. And I would appeal again for government to allocate more funding to the people that are waiting, and waiting hard and suffering while they are waiting on this home care package to be provided. Thank you.
Thank you.
I want to thank the Senator again for acknowledging the fact that, that the government is in the process of developing the home care package, continue in a different way. There was 140 million added to the overall budget this year, and which raised it to 446 million, and it's quite a substantial amount of funding. However, we all know that people are living longer, life expectancy is longer, and as we all know, in the coming years, there will be an increase of the population in over the 65. So we do need to work actively together to provide high quality and flexible service that not only best meets the needs of individual clients, but also reduces pressure elsewhere on the health system. The social care services, including home care and day care and respite, are an important component in enabling people to remain at home, as you've already said, and I can adhere to that myself. They also provide valuable support to the carers. We are aiming to improve the home care support service so that people can remain living with confidence, as I said, and dignity, and above all, in their community with security. While existing services is delivering crucial support across the country, it recognises that home care supports needs to be assured for better to meet the needs and the changing needs of our citizens. I'm very conscious of the fact, in replying to you from a statement that has been given to me, that on a daily basis I receive calls myself regarding people's home care packages being delayed, or even just home care hours. We will work together to ensure that to develop the current engagement in the details process to deliver a new standalone statutory system for the financing and regulation of home care services. This system is a key action under the Sláinte Care implementation strategy, along with improving the development support in the communities. And however, just to finish and add to the Senator's comments, I will, however, bring his concerns back to Minister Daly, and we all know that the best place to keep people is in their community and in their home, and we should be doing everything we can. There has been a substantial increase in funding, but I've already referred to in the statement that we are dealing with an older population, and the numbers continuing to build for long-term and home care packages increasing as well.
Thank you, Minister. Thank you, Senator. Now we'll move on to